Hi, my name is Alexis Cloud, and I'm here to talk to you about something that's very personal and near and dear to me, simply because I am female and I also had a family member who died from this disease. And this particular disease is called ovarian cancer. Ovarian cancer is a cancer for women, and it's also a cancer that begins in your ovaries. It's the #1 silent killer for women simply because it's not detected early. It's only detected in your later on stages. Some of the common symptoms in ovarian cancer is your urgent need to urinate, lower back pain, frequent vaginal bleeding, abdominal growth, as well as abdominal pressure and bloating. According to the Mayo Clinic, you can have a pelvic exam in which they go in and explore your pelvic to see if they see any cancerous cells. They do an ultrasound to take a picture of your uterus, as well as they have a surgery to remove samples from your ovaries and your uterus to detect if they see any. You can also have a CA-125 blood test, and this is a test that they use to detect ovarian cancer. But however, this test can give a false positive because there could be something else going on in a woman's body which have those blood test levels to go up. And some of the risk factors for the ovarian cancer is women who have a history of breast cancer as well as ovarian cancer. And sometimes for women whose mother or anyone in the family member that has had either breast or ovarian cancer, they go to the doctor to get tested, and sometimes these doctors then send to a gene specialist to see if they carry those genes. And for women whose mother has had ovarian cancer, they sometimes immediately go to the doctor and get tested, and with that they also just go ahead and remove their ovaries because so they won't have to go through the pain that they see their mother going through. According to the Mayo Clinic, the doctors also use this CA-125 test after the cancer is diagnosed simply to monitor the treatment. To monitor the treatment and to see how it's progressing in your body, to see if it's working, to see if it's not, to see what else they can do. And some of the only treatments that there is for ovarian cancer is that they remove your ovaries for women who have 2 ovaries, our fallopian tubes, we have 2 fallopian tubes. They remove our only 1 uterus, as well as doctors go inside the abdominal wall of a woman to try and remove all the cancer that they can get, as well as any lymph nodes that are nearby. Also, after your surgery is done, you immediately start chemo and radiation. And some of the side effects of taking chemo is that you lose your hair, you lose weight, you're depressed. It's just it's a hard test, it's a hard kind of procedure on anybody, for a woman or anybody. And one of the main reasons why this cancer is so near and dear to me is because I had an aunt. Her name was Pearlie Mae Lewis. She was a active churchgoer, and she was also a smoker, despite the fact of having asthma. And as I mentioned earlier, she's had asthma, so on this particular day in 2005, my Aunt Pearlie Mae was at her mother's house, which was my grandmother Lil Bay, and she was visiting her, and she had this bad asthma attack. And from there, she was rushed to Archibald Hospital here in Thomasville, Georgia. Once she was there, they realized that her left lung had collapsed. And the only way, they could get her breathing is they had to insert a chest tube. But with inserting a chest tube, you need family consent. The only family member was around was my mother. So my mother had to sign a consent form in order for them to have a chest tube inserted into her. After the chest tube was inserted, they had a cytology test on the fluid that they found in the lungs. After the test came back, they realized that there was cancer cells. And they also realized that this wasn't a primary site, this was a secondary site. The primary site was found to be in her ovaries. And from there, they diagnosed her with stage 4 ovarian cancer, the last stage. After a week of being at Archibald, she was then transferred to Shands, where she had a hysterectomy. They removed all of her reproductive organs in her body, and she also started radiation. She was there for about 2 months or more. The doctors told her that she would only have a year to live. And from then, she planned out her own funeral. And she also told my grandmother that she would die before her, simply because my grandma was a very sickly person. And so my Aunt Pearlie was just like, Shirley, I'm going to die before you will die. But that wasn't the case. My Aunt Pearlie my grandmother passed away on October 1st, 2003, after a long battle of illness. But only a year later, my Aunt Pearlie Mae passed away October 12th, 2004, which also happens to be my papa's birthday. She left behind 6 kids, her mother, 2 brothers, and 4 sisters. I can't stress enough to women about this. I'm a female. I see there's 4 females in this room. I can't stress enough. You know what's going on in your body. You know what goes on every day. And I must say, if you realize that there is something else going on in your body and that you know it's not normal, please, please go to the doctor and get those things checked out, because you don't want to be like Pearlie Mae, sitting at her mother's house, visiting her, and having an asthma attack, but only to end up in the hospital where they diagnosed you with stage 4 ovarian cancer.